Healthcare these days is changing so rapidly that an organization needs to be able to pivot and be nimble, and we can do that here at Northfield Hospital Clinics. Northfield Hospital Clinics is a community hospital, 37-bed inpatient facility. We're located here in the middle of a beautiful cornfield, just adjacent to Northfield, Minnesota, about 45 minutes south of Minneapolis and St. Paul. In addition to the great inpatient care we provide here, we also have our outlying clinics in our surrounding communities.
I think a lot of people think smaller hospital, you're not going to be as challenged. Healthcare is challenging no matter where you are.
I think that partnership is such a huge strength as we think about Northfield Hospital Clinics, an independent community hospital, really being able to partner directly with MEDITECH. Part of our strength is being nimble and small. We also are really excited that as we partner with MEDITECH, the MEDITECH team is also nimble, and they're also willing to make changes and pivot and take ideas that we have, which we think might be crazy ideas, and the team from MEDITECH can say, oh, let's give that a shot. And we're able to pilot that and try it. And I know that when I go to my partners at MEDITECH, they hear that, and they're also able to turn around and partner with us to put forward some really innovative solutions.
One of our priorities is that access to external data. We need to have our clinicians have the information that they need to provide care for these patients. I think it's very important to understand that each department does have their own workflows and that the care that they provide is very different. And that's one of the benefits of MEDITECH Expanse is that each department can be tailored to their specific needs. And so by working with specifically the ED or the birth center or med-surg, I can greatly understand what their needs are, and I can help them tailor their documentation. I can assist them with using the specialty care desktop so that they can easily document short interventions or titrate their medications to make their workflows more efficient.
Patients engage if their providers are engaged in that portal side of things. I think, communicating to them about their results, that ability to be able to refill their medications through that. The other way we've tried to make their appointments more efficient is through our questionnaires that we put out on My Health Info before they come in. I feel like the more that we can talk about how we use the portal so that they can get their lab results faster, patients do engage more by doing it that way.
We have the good fortune to have a number of dashboards we've set up where we take the trove of data within healthcare and try to boil it up to those images, those visuals that help us make decisions. A lot of those reports that we've built and we've been able to reference on a daily basis as leaders, thinking about things like patient census, patient flow, discharges, ORs, procedures, surgeries, outpatient visits, a whole plethora of things that really help us understand exactly what's happening within the organization.
It is really fun to see whether it's a functionality or a new software or a new product and something that really does make a positive impact either on the provider, staff, or patients.
We're really excited about AI, and I think the nice thing about AI in healthcare is that there's a whole range of possibilities. We're excited about partnering with our EMR, partnering with MEDITECH to do this work, and we think that there's a lot of opportunity.
I feel like our relationship with MEDITECH has evolved into a true partnership. We have spoken and they have listened, and they are being proactive and not reactive, as we are too. So we're learning with each other, and they're saying, oh, I see that this is a challenge or a barrier here. Here's how we can help.
Keeping care close to home is so important. And that's something that really is the bedrock of us as an independent hospital. Being able to be community-based, responsive to our community, and always investing those dollars back into services that are needed.